My name is Brigitte Ordóñez and my topic is alpha-1 antitrypsin deficiency. Definition. Alpha-1 antitrypsin deficiency is a genetic disorder that may result in lung disease or liver disease. Onset of lung problem is typically between 20 and 15 years old. This may result in shortness of breath, wheezing, or an increased risk of lung infection. Complications may include chronic obstructive pulmonary disease, cirrhosis, neonatal jaundice, or paniculitis.
Alpha-1 antitrypsin deficiency, AAT deficiency, is an inherited condition that raises your risk for lung and liver disease. Alpha-1 antitrypsin, AAT, is a protein that protects the lungs. The liver makes it. If the AAT proteins aren't the right shape, they get stuck in the liver cells and can't reach the lungs. Symptoms of AAT deficiency include shortness of breath and wheezing, repeated lung infections, tiredness, rapid heartbeat upon standing, vision problems, weight loss. Some people have no symptoms and do not develop complications. Blood tests and genetic tests can tell if you have it. If your lungs are affected, you may also have lung tests. Treatments include medicines, pulmonary rehab, and extra oxygen, if needed. Severe cases may need a lung transplant. Not smoking can prevent or delay lung symptoms.
Today's video we're going to be discussing alpha-1 antitrypsin. So let's begin. What is alpha-1 antitrypsin? Well, it's a protein which is present in the blood and in the bodily fluids. What does alpha-1 antitrypsin do? Well, it inhibits a number of proteolytic enzymes that hydrolyze and destroy proteins. It also inhibits an enzyme called elastase, which is secreted by the neutrophil, which is a type of white blood cell. And what this enzyme does is it degrades the elastin of the alveolar walls. So, where is alpha-1 antitrypsin produced? Well, most of it is synthesized and secreted in the liver, and some is also produced by monocytes and alveolar macrophages. So, what is its role in the lungs? Normally, the alveoli are exposed over a certain amount of time or chronically to low levels of the enzyme elastase, which is produced by the neutrophils. So what happens is the elastase which is produced destroys the elastin of the alveolar walls of the lungs. However, alpha-1 antitrypsin is an inhibitor of elastase. So what this means is if an individual has low levels of alpha-1 antitrypsin, or they have the inherited disorder alpha-1 antitrypsin deficiency, there's greater destruction of the connective tissue in the alveoli walls of the lungs, which will eventually result in emphysema. This is the video on alpha-1 antitrypsin. Thanks for watching. If you have any questions, write them in the comments.
Applications in medicine. Antitrypsin alpha-1 is due to the mutation in the SERPINA1 gene that results in not enough alpha-1 antitrypsin. Risk factors for lung disease include cigarette smoking and environmental dust. The underlying mechanism involves unblocked neutrophil elastase and buildup of abnormal in the liver. It is autosomal codominant, meaning that one defective allele tends to result in milder disease than two defective alleles. The diagnosis is suspected based on symptoms and confirmed by blood tests or genetic tests.
So alpha-1 antitrypsin deficiency is actually a hereditary lung condition in which you are born with a certain gene that helps ward off infections and stuff into your lungs. So without this gene, when I get an infection, it actually attacks my lungs rather than protect them from illnesses. When I was first diagnosed in 2001, I didn't really have too many symptoms. I knew that I had it. My father was tested, and my mom was already positive. So at that time, we knew that chances were pretty high that I was going to be a carrier, but also have the deficiency. My symptoms weren't real strong. I had some shortness of breath upon exercise, going up hills, steps. So back then it wasn't really a game changer in my life. I knew I had it, so I tried to take care of myself. And with this disease, it just progressively gets worse. There is no treatment for this disease at all. It's just a matter of taking care of yourself and doing some preventative measures. In October of 2016, my oxygen levels were pretty low upon seeing my physician. So at that time I was put on oxygen. Wasn't quite 24/7, but I did have a portable in case I did go out and get shortness of breath. But the oxygen was full time at night. By January of 2017, I was unable to go up steps anymore without really stopping using my rescue inhaler. And from there, it seemed to take a steady decrease to the point where we're at now, which is, it doesn't take much activity anymore to get that shortness of breath to come on. The best course of action I have, of course, is my rescue inhaler. And with the oxygen, just taking some low, deep breaths seems to help kind of get my oxygen level back up. And of course, just stopping and resting what I'm doing. Just making sure that I sit down, relax, before I get up and attempt any kind of activity again. But definitely the inhalers do help, and the oxygen. Their only long-term cure for the alpha-1 and now the very severe COPD that I have is a lung transplant. If you have any doubt, get tested. Alpha-1 antitrypsin it's detected with a blood test. It's very easy, very painless. It's a struggle when you have to breathe and can't get that deep breath. So I would say just as much prevention as people can and get tested and know what's out there and take care of yourself while you can.
Hi, this is Dr. Alfaro. I'm a lung and sleep specialist at the University of North Texas Health Science Center. Alpha-1 antitrypsin deficiency is a condition that occurs mainly in patients with underlying lung disease, COPD, which stands for chronic obstructive pulmonary disease. Most people know it as emphysema and chronic bronchitis. COPD occurs mainly in smokers. It is a serious condition that can progress and cause lung failure. Because of that, it is very important for us to diagnose COPD early. Patients with COPD generally complain of shortness of breath, chronic cough, and wheezing. Patients with alpha-1 antitrypsin deficiency are much more likely to develop COPD and at an earlier age than their counterparts. Alpha-1 antitrypsin protects the lungs, and in the absence of alpha-1 antitrypsin, lung damage occurs at a much more rapid rate. One of the things that we find in patients with alpha-1 antitrypsin deficiency is if they quit smoking, they can preserve their lung function a lot better. This is not only true for patients with alpha-1 antitrypsin deficiency, this also holds true in patients with COPD, and because of that, it is important for patients who have COPD or any smoker to quit smoking early. Not only does smoking cause underlying lung disease, COPD, but it can also lead to coronary heart disease, premature heart attacks, cancers, and others.
Pros and cons. Newborn screening has several pros and cons and is currently not recommended, with the possible exception of countries with a high prevalence of alpha-1 antitrypsin deficiency and smoking, where adequate counseling services are available.
Chronic obstructive pulmonary disease affects 10% of the population. The leading genetic cause of COPD is reduced production of a protein called alpha-1 antitrypsin, or A1AT. In healthy individuals, A1AT protein, M form, is secreted by the liver into the blood and protects lung alveoli from excessive activation of an enzyme called neutrophil elastase. In individuals with A1AT deficiency, a mutation in gene encoding results in A1AT Z form accumulation in the liver, which causes liver and lung damage. The lungs have cells called neutrophils that protect us from bacteria by creating neutrophil elastase. But in the absence of A1AT, the neutrophil elastase damages elastin, the major supportive tissue in the lung, leading to emphysema. Researchers are using mouse models to test treatments for A1AT deficiency. An A1AT knockout mouse was created by deleting SERPINA1 genes found in mice. These knockout mice develop lung phenotypes similar to those seen in humans with A1AT deficiency. However, these mice have no liver phenotype. So, another model known as PyZ is transgenic for human ZA1AT protein, which has the liver phenotype, has been developed. Researchers have bred the knockout mouse with the PyZ transgenic mouse to obtain a model closely resembling the human phenotype. This A1AT mouse model allows researchers to test in vivo a variety of novel therapeutic strategies for A1AT deficiency.
Issue applied in Ecuador. A1AT is due to a mutation in the SERPINA1 gene that results in not enough alpha-1 antitrypsin. Risk factors for lung disease include cigarette smoking and environmental dust. The underlying mechanism involved unblocked neutrophils, elastic, and buildup of abnormal A1AT in the liver. And finally, in the conclusion, alpha-1 antitrypsin deficiency is a common genetic condition that can be involved in premature lung and liver disease. Consider the diagnosis to allow earlier institution of AAT augmentation therapy to slow the progression of premature lung disease in affected patients. Thank you.